The truth about epidural steroid injections for back pain relief. Meet Lucy. She's considering epidural steroid injection because it was recommended as a potential solution for her chronic back pain. But does she know the truth behind this medical procedure?
Lucy, epidural steroid injections, ESI, can be a viable option for temporary relief of your back pain, but it doesn't correct the underlying issue causing your pain.
An epidural steroid injection, or ESI, is where the doctor will inject steroids directly into the epidural space of your spine. Like any medical procedure, ESI involves risks. If the injection is not precise, it can potentially damage nerves in the spinal cord. In fact, most people don't realize that epidural steroid injections have not even been cleared by the FDA for back pain. There is great exposure as even Dr. Oz questions the use of epidurals and points out the dangers.
Another danger of ESI is the risk of infection.
Whenever a needle penetrates the skin, bacteria can be introduced into the body, which can lead to serious complications.
ESI can also cause adverse reactions in some individuals. These reactions may include facial flushing, sleep disturbances, elevated blood sugar levels, and mood changes.
Remember, these dangers are potential risks with epidural injections. They don't happen to everyone, but they would be a high price to pay for a procedure that gives temporary relief at best. When people do obtain relief from epidural injection, it can last up to about 1 year, as little as a few weeks, or anywhere in between.
A 2018 study published in the Lancet Medical Journal states patients should avoid harmful and useless treatments, and doctors need to address widespread misconceptions about their effectiveness. For example, there is limited evidence to support the use of opioids for low back pain, and epidural steroid injections and acetaminophen are not recommended at all.
I never realized the dangers of epidural steroid injections and that they only provide temporary relief. It's a lot to take in.
Sometimes your doctor may feel that even temporary relief from an ESI is worthwhile, if it enables you to engage in rehabilitative treatments that do get to the root of the problem. In cases where the severity of spinal pain is extreme, an epidural may help the patient more comfortably begin a rehabilitation program like IDD therapy, advanced spinal decompression, to get significant long-lasting results. IDD therapy has proven 92% successful in relieving back and neck pain from people who were actually already scheduled to have surgery but tried IDD therapy instead. The American Association of Neurological Surgeons presented these findings, also showed that patients reporting initial success with IDD therapy treatment continued to have a significant reduction in pain 2 months after completing treatment, and again, even 2 years later. Proven relief, no drugs, no needles, no invasive procedures.
It's safe and cost-efficient.
Now that Lucy has a greater understanding of the use of epidural injections for spinal pain, she is better prepared to make the decision that is right for her. Understanding the complete picture of any medical procedure is crucial. Get informed and be proactive in managing your healthcare. To find out if you're a candidate for advanced non-surgical spinal decompression with IDD therapy, contact us at www.iddtherapy.com.